Everyone, today's my topic is types of adverse events. So let's start. Var- Various adverse drug reactions, which is nausea and vomiting, diarrhea, giddiness, chest, thyroid disorders, depression, blurred vision, skin rashes, gastritis, and pain in abdominal. So, what is the definition of adverse event? Any untoward medical occurrence which present during treatment with a pharmaceutical product but which does not necessarily have a causal relationship with this treatment. In adverse event, there is no causal relationship between the drug and the event. So let's start. So next is the adverse drug reaction. So, any noxious effect which is suspected due to drug occurs at a dose normally used in a man. So, therefore, an adverse drug reaction is an adverse event with a causal relationship to a drug. So, Let's see classification of ADR. So onset of event. On onset of event, first is acute. Onset of event. First is acute, which requires less than 60 minutes. The event which occurs less than 60 minutes. So second is subacute, the event which occurs between 1 to 24 hours. So third is latent, which requires greater than 22 days is latent event. So the event is also classified on the type of reaction, which is also known as Wills and Brown's classification. So in Wills and Brown's classification, there is type A, which is augmented, type B, which is bizarre, type C, which is chemical, type D, which is delayed, type E, which is exit, type F, which is familial, type G, which is genotoxicity, type F, which is familial, type H, which is hypersensitivity, type U, which is unclassified. The adverse event, which can be classified into severity of the event, which is minor, moderate, severe, lethal ADRs. The other classification is side effects, genotoxicity, intolerance, toxic effects, drug allergy, photosensitivity, drug dependence, carcinogenicity, drug induced disease. So, type A Type A is so let's see briefly the Brin and uh, Wilson's classification, which is type A is augmented, which generally depend on the pharmacology predicted from the pharmacology of the drug, which is dose dependent, can be elevated by a dose reduction. So example of this is anticoagulant, which is bleeding. Type B is bizarre. Reactions cannot be predicted from the pharmacology of the drug, which is not dose dependent. Host dependent factors important in predisposition. Example is penicillin, which gives anaphylaxis. Type C is chemical reaction. Biological characteristic can be predicted from the chemical structure of the drug. The example is paracetamol, which requires hepatotoxicity. Type C. Type D is delayed, which requires end of the type E is the end of the treatment occurs on withdrawal, especially drug is stopping abruptly. Which the example of type E is phenytoin, which gives seizures in patients. So these are the types of areas.